evening and welcome to Hope TV. You are on Health Check. It's only the place where you look and live. My name is Kerry Kagiri. Today's conversation is by far the most scary. And I'm not here to scare you. I'm here to make sure that you are informed, you are educated, and with me in on set is two brilliant ladies. I just want to go straight to introducing them, and then we'll be introducing what we're talking about. So we have Dr. Susan Karanja. Is this your debut on Health Check?
Yes, it is.
Karibu, you came ready.
Asante sana.
You are a neurosurgeon at Kenyatta National Hospital.
Yes, I am.
And just for a moment, why neurosurgery?
It was a very exciting, challenging new field, and I thought, why not?
What?
Yes.
Okay, what was your second pick? Because I know you have to do like the whole medicine, then I'll pick.
My second pick was still surgery, but cardiothoracic. Now to do the heart and lungs.
You're so daring. I thought you didn't say dentistry. No.
No.
So and so far, what's been your biggest highlight about what you do in your service?
The biggest, sorry?
The biggest highlight of what you do in your service.
I think for me, and any neurosurgeon for that matter, it's when you actually get a patient, go to surgery, and they recover and go home and go back to their normal life. I think for me, that's what keeps me going every single day. It's the drive.
I love it.
Yes.
And when you say go back to normal life, it means that you can go back to normal life.
Yes,
absolutely amazing. And also with us on set is one of our very own. I don't think I've hosted someone who's a colleague and a senior colleague, Rev.Judy Anabwani. Thank you so much for coming.
Thanks for having me.
And I've just highlighted your introduction, but you're here for a very special reason.
Yes.
And just before that, introduce yourself to our audience. They're seeing you on Health Check for the first time.
Yeah, Rev.Judy Anabwani with Christ with the Answer Ministry. I work at the Christian Education Department, but I'm also domiciled at Sitam Karanja.
Absolutely. That's where you enjoy the move of the Lord.
That's where I preach.
That's where you preach as well. Yes. Okay. Awesome. As we do that, we are talking about brain tumors. And when you hear brain tumor, the first thing that comes to your mind is fear, because you're like, what is something doing in my brain?
Yeah.
But we could start with, what is this brain anatomy and structure? What does the brain look like for someone you've seen live?
Yes.
Okay. What's the brain anatomy? Just in general for someone who's watching and didn't do biology.
Yes. So the brain is basically the structure that is inside your skull. And the brain is actually two big hemispheres.
Okay.
And then a smaller part at the back, what we call the cerebellum. So the two hemispheres are what we call the cerebellum, the left and the right. And that's why you keep hearing us asking you which hand you write with most, because if most of us are left brain dominant, which means most of the things we do, like speech, our personalities are on the left side of the brain. Now, the back of the head, where the cerebellum is also where that structure everyone loves to talk about, the medulla oblongata is.
Use your medulla.
Yes, but the medulla oblongata, all it does is transmit things from the brain to the spinal cord. So it's where the brain and the spinal cord marry.
Okay.
And that, in a nutshell, is what your brain is.
Cerebrum iko wapi?
Cerebrum ni kubwa.
Oh, ni kubwa.
Yeah, the big one, it's even behind you.
Oh, okay, there's a cerebrum.
Yes, yes.
Okay, so that's not only the brain. So it's two hemispheres.
Yes.
Okay, that's quite interesting. I guess you didn't know that. And now, what is the function? Maybe because I said use your. What's the function of the brain?
The function of your brain is it makes you who you are.
Okay.
When we say Kerry, that personality comes from the brain. So it's what you used to think, to speak, to feel, all those wonderful things we say that make us human, speech, touch, all that comes from the brain.
Okay.
Emotions, those are all a function of the brain. Even though people say go with your heart, all that
I mean, go with your mind.
It's actually go with your mind.
Yeah.
Because it's all happening in your brain. It's what helps us form relationships as humans and controls now every muscle in our body. That is a function of the brain.
That is so interesting. And just coming to Reverend Judy, a brain tumor is something you know too well.
Yeah.
What was the first time you went to find out, even before you go to how, and you're told you have a brain tumor? What went through your mind?
First of all, I thought the end has come.
Oh no.
For real. Because for someone to tell you that you have a tumor in your brain, especially after you have been sick for so long, and they tell you have to undergo surgery for the tumor to be removed, for you to be able to live normally. And for me, it was so crude the way I was told. I was told, we'll take you to theater, we'll open you up, we'll drill into your skull. Those exact words. We'll drill into your skulls and get the thing out.
The thing.
Yes, those were the words. Get the thing out and close you up again.
No, Daktari wants to find out who that is and punch them in the face.
Those were the exact words. So when you hear someone say they're going to drill into your skull to get into the brain, it's already scary. And you have been suffering for a long time. You have no energy. So you're wondering, will I manage 6 hours in theater? And then you're told after those 6 hours, you'll be in ICU for 2 weeks. And then another 2 weeks in the HDU, and another 2 weeks recovering in the general ward. I thought I would not make it.
Oh my. What did they explain to you a brain tumor was? And I'm coming to you, Daktari, to actually explain what a brain tumor is. But what did they tell you a brain tumor is? Or it's just a thing?
Initially, I went through a series of MRIs.
Yes.
So the doctor that checked me in was not a neurosurgeon, because I had passed through many different doctors trying to find out what was actually wrong with my system according to the symptoms that I was manifesting. So this doctor just checked me in for pain management because I was in horrible pain. And in the process, he decided to get to the bottom of this pain that never goes away and decided to MRI every bit of me.
Wow.
Yes, I was in MRI day and night. He was trying to get to the bottom of it. So he came and told me, Judy, we found a swelling. That's how he called it. We found a swelling at the back of your head, the place where the spine meets your brain. There is a swelling. He didn't call it a tumor. And according to my expertise, I can't tell you what it is. It could be dissolved by a drug surgically, or it could be left there. I don't know what it is, but I have to call in a neurosurgeon to check out what it is, to tell us what it is, because it's in your brain. He was a very nice doctor, the one who told me. He used very polite language.
Yeah.
So I waited for the neurosurgeon for the whole day. He was breaking the news for me in the morning because I did the MRI in the night.
Yeah.
That was the first thing. He came, and he was very nice. He took his time with me, a whole hour. In fact, I must thank that doctor. He sat on my bed for a whole hour just explaining and helping me get used to the idea.
Yeah.
So the neurosurgeon came at around this time. But thank God my husband was there.
Yeah.
He was waiting.
Hi, thank God for husbands.
Yeah.
I hope to get one.
Amen. May the Lord. So we waited for him for the whole day. So he said, I am here. Where is the MRI? And we gave it to him. And he put it on the light and he said, so he asked me, how have you been feeling? So I explained what brought me in.
And we'll be talking about that shortly as we get into your symptoms. Yeah.
Yeah. So he just said, okay, this here is a brain tumor. And there is no drug that can get it out. The only option is to get you to theater, open your head up.
And remove that thing.
Drill in. He used the word drill in.
Sorry.
And remove that
That's
thing.
still etched in her mind. I'm
Yes,
so sorry.
it's been hard to forget.
I'm so sorry. Dr.
Yeah.
Susan Karanja, talk to your colleagues. But it's okay. They'll do well.
Yeah.
What is a brain tumor?
So a brain tumor is basically when the normal cells around the brain, whether it's the neurons within the brain itself or the supporting structures, or outgrow. So they don't follow the normal processes of the normal cells, and they reproduce much faster than the normal cell would. And the resulting growth thing that happens is what we call now the growth or the tumor. And basically, tumors range from what we call benign
Yes,
to what we call malignant, which is cancer. Benign being that those cells which have grown are very close to the original cell. Malignant means they've really changed and they're really abnormal looking, and those tend to grow a lot faster, which is why cancer is so challenging to treat. Yes.
Absolutely. So it's not a swelling.
Well, no, I wouldn't
You know,
call it
right?
because a swelling denotes that it's within the normal structure and
Yeah,
something. Yeah, so
yeah.
it's cells that are growing and are alive.
As we talk about that, we realize that there are different places that this tumor could happen, and they have different names.
Yes, they do.
Maybe from her definition, what would you describe that?
From hers, it's a bit hard, but
Yeah.
the different types which are very common, we have what is known as a meningioma, which is more common in women. It's a typically benign tumor.
I think that I know. Is it from the?
No, that's still in the head.
Okay.
Yes, that one is still in the head. And then, so that falls under what we call primary tumors, so cells that come from things around the brain. So the meningioma comes from the covering of the brain, what we call the meninges. Then we have gliomas, which now occur within the brain itself, coming from the supporting tissue. Neuroma, which is from the neurons themselves. And then now at the back of the head, we have what's known as medulloblastomas. And then secondary tumors now are things that start elsewhere in the body and come into the brain. So breast cancers. We have
What's the name for that in breast cancer?
when it comes,
Like when it comes from the breast to the brain.
it's a metastasis.
Just
We just call it a
okay,
metastasis of a breast cancer.
Okay.
Yes.
Wow.
Yeah. So metastasis is a big group for us, and the others are just like things in the nose, or what you call nasopharyngeal cancers, which erode through the bone and now end up inside our brain area. Yes.
Okay. Wow. So symptoms and signs. What symptoms did you have? Because I realized, just trying to do my research, people went through so many things. Someone sneezed and felt such a sharp pain in their brain and realized there's something wrong with me. I need to go see a doctor as soon as I can. And someone else just started slurring in their speech and realized, there's something wrong, but maybe I'm tired or dehydrated. You know, there are various things you hear about the same. Rev.Judy, what was your experience?
It was a progression of so many symptoms. By the time I was finding out, I think that was now the peak of it. But looking back, I used to feel cold. That even when the sun is up, I am cold. I actually used to dress up in so many layers. My sisters used to laugh at me all the time. I used to feel abnormally cold. I think those were the initial stages. Too much cold, common cold that never goes away. And then I had this acidity that never used to stop. I would go for checkup. I would be given drugs. As long as I was on drugs, the acidity would be quiet.
Yeah.
But the moment my drugs are gone, it will explode again. And so even my diet was brought down. The things I could eat had become very few. I couldn't eat a lot of starch, anything that required a lot of energy to digest. I couldn't eat. I couldn't eat meat. I couldn't eat githeri. I couldn't eat things like sweet potatoes. I think I had come down to things like rice, maybe with cabbage, and white porridge. I couldn't take the one that people love, I couldn't take.
Yeah.
My diet was completely reduced. And as time went by, I completely lost appetite. I would go a whole day without food and I don't feel anything.
Wow.
Yes. And
what stage of your life is this? Are you married? Are you still?
the others started
Yeah.
when I was still single.
Yeah.
Like feeling cold. I was a young adult when I was feeling cold, common cold that never went away. I was a young adult. Acidity started after I had my 2 babies. Then now acidity that doesn't seem to go away. It's constantly there. And then I think my system just became susceptible to other things. Things would just catch me easily, stomach upset, malaria. My immunity was just down.
Yeah.
Yeah.
And Daktari, all this and everything she said, to be honest, has nothing to do with the brain, according to the exterior. So she's going for acidity. Yet, somehow, what could you relate that with?
Um,
As in, how does a doctor actually now go and check the brain after all that? Is there anything you can relate to?
Actually, it would be very hard to take you back all the way to the brain.
Yes.
But you see, something like now how she's saying the common cold. I don't know, was there a cough as well? Or is it just,
Sometimes there's a cough.
yeah, so if someone says they're having a cough that's not going away, as a doctor, you start wondering, after you've checked now the chest and everything, one of the things that would trigger, especially because her growth was at the back of the head, swallowing, is she able to swallow well? Is some of, like when she's asleep or resting, is something going through the wrong airway and causing now this recurrent coughs? So that's one of the we think. And then now with the appetite and all that, you start worrying. Well, we think of a growth, a tumor, but that tends to happen more with malignant.
Yes.
But you see, with something at the back of the head, it will affect swallowing, it will affect, and if you can't swallow, of course, it limits how much you can eat.
Yeah.
So that's how I'd tie it in together.
Yeah. Okay.
Yeah.
So you go to the doctor, and through this series of tests, eventually.
Yeah, because now it was okay. Initially, before I actually went to this doctor, it started with a very serious cough, coughing non-stop. It wasn't obeying any syrup. I was just coughing, and in a matter of hours, my throat was completely red, and my head was aching like crazy, and I was passing out. So when I was rushed to hospital in the night, they said my lungs were showing an infection that they could not place on pneumonia. They didn't know how to deal with the infection that they were seeing in my lungs. But I had shortness of breath. I had to be enabled to breathe.
It was COVID time. You could have been somewhere
in isolation. Yeah. So my lungs were constantly failing. That is what used to take me now to hospital. My lungs were constantly failing. And I was like that for almost a year. I was on inhalers. I was in and out of hospital. They were treating my lungs. So I was seeing a chest specialist for almost a year.
Pulmonologist.
I was seeing a chest specialist for a whole year. Then now people around me were getting concerned. I have doctors' friends who were like, this doesn't sound right. Because I was on those 2 inhalers, but I would still get attacks. Like, for example, we are women, you are cooking, and the onion just gets burnt kidogo, I would get choked. So I'd even stopped cooking. If I was driving and there is a lorry emitting fumes, I would get an attack. So the attacks were so frequent, but it was pegged on my lung. And that never went away. It was getting worse. I was on very high-tech medication. I was on inhalers. I was being nebulized, but the lung situation was not responding to any treatment. Then the headaches set in. It was horrible headaches. I think they were in the veins. It's not headache, it's pain in the head, the entire head, everywhere. You don't want to hear people talking. You don't want to see. It was horrible. I was going crazy.
If you're just joining us, we are talking about brain tumors. I know maybe you came in and you had a chest and you had all these things and you're wondering what is going on. Well, that's the story of Rev.Judy Anabwani, who has recovered, as you can see, from a brain tumor. And it took all that suffering, I'd call it suffering to be honest, for you to get to know what you're actually going through. But as we continue, Dr. What causes brain tumors?
Well, sadly, for most brain tumors, they're what we call sporadic, meaning they just happen. The only real proven causes of brain tumors are actually exposure to radiation. So those who've had radiotherapy or those who work around areas with a lot of radiation therapy are at risk. And then the other real known risk factor is some of the familial genetic syndromes. So we have things like tuberous sclerosis, which manifests with skin lesions, and those typically tend to get huge tumors in the brain. We have other syndromes like Lee-Fraumeni, adenomatous polyposis, which is more of abdominal polyps that form, but at the same time, they're at risk of developing brain tumors. So for the vast majority of people, unfortunately, we can't predict so-and-so is going to get, so-and-so won't get. It's sporadic. And then we have some tumors, like the one I mentioned, the meningioma, which tend to have a predilection for women. So it's about 8 women to 1 man ratio of getting it, which just tells you probably there's also something to do with hormones, but that link hasn't been fully proven.
Absolutely.
Yeah.
And when you talked about signs and symptoms, she shared her story, and we were getting, I think, into the part where we're like, okay, now there's something you need to check your brain, because this headache that feels like just pain.
Yes.
Generally, sometimes headache when I up in the right, you have it comes different places. Sometimes it's right here.
Yeah.
What are some of the signs and symptoms we need to be very careful for?
Okay. So one of them is headache. And basically, we always say any headache that you have that is getting worse, that is something that you need to be checked for. Because if you find you started with Panadol and as time goes, you're using stronger and stronger medications, it's good to get checked.
And what is time?
Well, we say chronic headache. So if you've had a headache that's continuous and that you're needing to increase your dose of medication over more than a month or so, that one you need to have it checked. We also say for people like us who wear spectacles, normally we only need to get an eye check once a year. But if you find your prescription is getting changed and still your vision is still deteriorating faster than that 1 year period, we need to suspect there's something going on in the head. The other thing is any development of loss of any of the functions of the brain. So difficulty hearing in one ear, speech getting impaired, whether it's slurred speech or finding difficult remembering some words, weakness of a limb or a side of the body, basically like what happens in a stroke, all that should be a sign. Any convulsions, so seizures, is a sign that there could be a brain tumor. And then the other thing is, which is unique, for tumors that are at the front of the brain, what we call the frontal region, change in personality. So these people manifest like a psychiatric illness. So can
Like
be
bipolar.
Yeah, it can be bipolar, can be psychosis,
Schizophrenic,
and substance abuse.
Yeah.
That can actually be a brain tumor. And that's why a lot of psychiatrists, before they start people on treatment, will insist on a brain scan. Another thing unique to ladies is infertility. Breast leaking milk and you've not given birth.
Wow.
Yes, periods going away. That could be a sign of a brain tumor. Hyperthyroidism, all those are linked to tumors of the pituitary. And then, of course, there's the vomiting. If now the pressure in the head is too much, drowsiness, confusion, those are basically what we see. But the most of the brain tumors will start off subtle, just the way Reverend has described, and so we could miss it. So you have to be very keen on your health and know what is normal for you. Yes.
I'm coming to you to discuss the diagnosis of the same. But meanwhile, let's go back to this headache that is pain in your entire head. And of course, at this point, you have prayed and interceded and done everything. Now you go back to hospital.
Yeah, I go back to hospital. Like I remember Sunday, I preached in 2 services.
What?
Yes. That time I was serving at Sitam Gong, and I happened to be the only pastor that Sunday with interns. So I literally served communion in 2 services and preached in 2 services and went home. So I was due for a checkup the following day. But because my friends were now concerned and people who loved me were concerned, so they just speculated. Maybe you may want to see a cardiologist. Maybe something else is the matter and not really your lungs. So I took that advice.
So cardiology now.
Yeah, because if your chest has been treated for more than a year and you are on high-end medication and inhalers and nebulization and is not getting better, and your attacks are even becoming more frequent, then something else could be wrong. But they couldn't tell what could be wrong, so they just speculated, try checking your heart. So instead of going back to the chest specialist, I was actually discharged a week ago, went back to work. Now, was cleared and went back to work for a week, but I was due for checkup. So instead of going to my regular chest specialist, we decided to go to the cardiologist, who sat down, listened to my story. That doctor is fantastic. He gave us more than 1 hour just describing the history of everything. But he said, it is not normal for you to go through this pain, because in the middle, I would stop and do like this, telling the story.
And the way our sicknesses misbehave when you go to the doctor. You're so sick, then you show up at the doctor. You're like, I was feeling pain here. It's like it disappears. Yours was there. You are sick.
Mine was there. So my doctor friend would take turn to explain, because she had been with me, would take turn to just explain what I'm going through. So the cardiologist said, from what you have described, I don't think it's anything related to your heart. But now that you are here, let's just rule out the matter of your heart. So he checked my heart. My heart was okay. I went through a lot of testing in his office. My heart was okay. But he said, I can't let you go home, because this headache is not a normal headache.
Yes.
You may even pass out as a result of it. So I told him, let me go and put my house in order. Because I was the only pastor. So I needed to go and leave the church in order before I come back for admission. So the following day, I go to church, put everything in order, ensuring the senior pastor is coming in the week, there's someone to preach on Sunday. And I rush back to hospital for admission. So I get admitted for pain management because the headache was horrible. But the miracle of it, I look back, I was driving myself all through. Yes.
Right.
I look back and I think that was just a miracle of God, that I was able to drive myself all through to work, back and forth. Because when they found, like, have you been driving? They said, you can't drive anymore. But I continued driving even after that. I drove until the last minute. So he checked me in for pain management in between the different tests. But even him, he did not think it's anything in the brain. So they thought maybe it's a clot somewhere in my system. That's why they were MRIing and scanning every part of me. So the neck showed something, the head showed something, and they decided to do the entire thing, injecting with me some dyes to try and separate. They said separating blood from the what? The doctor knows. There's a dye they inject into you that helps them see clearly in the MRI. So they repeated just to see clearly what it is. That's when they said, this is a case. The cardiologist said, he didn't say tumor. He said, a swelling. I think he was kind.
Wow.
He was really kind. He said, a swelling. And then when the neurosurgeon told us like that, by the way, he spent less than 5 minutes with me and said, let me know when you want to do the surgery. I'll book the theater. And he left. And I was crying.
I'm sorry.
Because now you are hearing, it is a brain tumor. Who wants to hear that there's something in their brain, that their skull is going to be drilled into? You are gone.
Sorry about that.
If it is your leg.
Tell us sorry on behalf of your colleague.
I'm sorry.
I'm sorry about that.
If it's your leg, you can say, if they take one, I can remain with the other. But now your brain. It's everything. But now he was able to explain that the tumor was lying to my left. And he said the nerves that are responsible for breathing lie to the left, on the left side. So when there is pressure in the brain, there is no emission of oxygen from the brain to the lungs. So that is why my lungs were collapsing.
This brain is so important, and every part of our body is quite connected. I mean, wow. So that was the situation.
That was the situation. So my lungs were perfectly okay. It was just the pressure in the brain because of the tumor that was interfering with the the nerves that are responsible for breathing, that connects the brain and the heart. So the pressure was interfering with the emission.
I'm just looking forward to hear whether you've started eating guashes, because I don't
love
know if life
guashe.
is
I
without
love
guashe,
guashe.
but we're getting there. Daktari, diagnosis, and we'll be going on a short break after we hear this. We have so many questions. If you have any questions on brain tumors, things that you should check out on, I can't believe I'm just saying that word, brain tumor, because to me, honestly, I've done so many episodes of Health Check, and when I saw, when we were just going through production, I'm like, brain tumors. And Reverend had one, and she's right here. And so, yeah.
It takes God.
It does. I can't imagine, but we'll get into that. Diagnosis.
Yes, so diagnosis of a brain tumor is dependent on one, you showing up, first of all.
Please show up. Please show up. Tell them to show up.
So that now we can take the history and try and figure from the history what's most likely to be affecting you. Then, of course, now from there we go to the tests. So the tests we generally do, we start off with a CT scan of the brain, and we do what is known as a CT scan with contrast. So contrast is what Reverend was saying is injected, the dye. The CT scan is the most basic, and we advocate for it because currently in Kenya, at least every county has a CT scanner. So there's no excuse to say, this headache, let me just wait, I'll see. But there is a scanner available. If we see something on the CT scan, then we move to the MRI. And the reason we do the MRI scan is because it has a lot more details. We're able to see finer things, we're able to see the vessels a lot better. And again, even that one we do with the contrast, that dye, just to help show the tumor where it is and what.
This as clear as this one of ours.
Yeah.
Is a CT scan or an MRI?
This one of yours looks like a reconstructed MRI.
A reconstructed MRI, okay.
So it helps us see the lesion when you do the MRI. Helps us see what structures are near the nerves, the vessels. So even as we plan surgery, we're trying to plan to go through the safest route. Then the other tests we do are now on the blood, just to make sure that everything in your body is in order, because brain surgery is a major operation. So you need to be physiologically in a state that you can go through the surgery without complications. So we look at your blood count. Are your kidneys working? Is your liver okay? And then, of course, we'll need to take a sample of your blood to know your blood group, so that if a transfusion is needed, we're ready. But our big two ticket items are the CT scan and then the MRI. And the MRI has a lot of other fancy things. So you can do things that show us some very fine tracts in the brain. So that's called tractography. There's a form of MRI where we assess the chemicals in that growth, and it helps us know, is it likely to be an infection or is it a malignant tumor? So those are our mainstays.
Okay. What else does a CT scan and MRI show? Because I once had an accident and I was told, go get a CT scan.
So CT scan, we like it because it's very quick. And when you've had an accident, it will show us blood, it will show us air, it will show if your brain has swollen. It shows us the bones very well. So you can see fractures of the brain, of the skull very nicely, or of the bones of the neck. And basically, in case there's anything that's, once the brain is pressed, you can see because the brain looks like it's moved a bit. So the CT scan is quick and it shows us quickly there's something here. So even if it won't define for you very clearly, at least hey, there's something here. We need to move to the next level quickly. Yes.
Wow.
Yeah.
We'll continue shortly and see what happened after this discovery, and if Reverend's skull was drilled into. What? I'm still babbling. We are coming back also to pick up all your calls, all the questions you might have. I see Dr. Ismaili. I feel so safe. I was thinking this would be those serious shows for, but at least with her smile, I feel reassured. And you're going to be fine. I think many people are afraid of coming out to the doctor because you're like, I just don't want to know. And we also discover that, there are people who have had a tumor in their brain for years and years on end, and it just manifested at a certain point. So we can also have that conversation. Rev.Judy, do you know how long it was there?
I can't tell.
You can't tell.
Yeah.
Okay. So
looking at the progression of the symptoms, maybe 10 years or so.
Wow. Okay, we'll go on a short break. We'll be right back. You're watching Health Check. It's on Hope TV, where you look and live. We're coming back with all your questions on 22232. The number is right here. You can also call us live in studio. I have paid consultation. Dr. will be answering, and Neurosurgeon answering your questions. So feel free to call us as well live on air. We'll be right back. Hey.
This week on Turning Point.
If things are bad on the outside, listen to me, but the Holy Spirit is in charge of the inside, He will give you peace. And the Bible says it's peace that passes all understanding. Isn't that true? And you can't understand that unless you've been there, and you can't tell somebody, oh, I've been where you've been. I know. No, you don't. You don't know what I've been through because you haven't been through what I've been through. And I don't know what you've been through. But I know this, when you go through something like that actually pulls at the very fabric of your life, if the Holy Spirit is in your heart and you're walking with the Lord, He will give you peace, and it will be something like you can't even explain to someone else. And if you try to tell a non-Christian about it, they'll just look at you like you're weird. So it's how you think about things. It's your mindset. It's setting your mind. Set your mind on the Spirit.
That's this week on Turning Point by Dr. David Jeremiah.
The Kesha was so full in Udiru, and the speaker was preaching and I was interpreting him. But to my heart, he was preaching my favorite book, but he was not bringing the word to the congregation the way he is supposed to bring it.
Which book is this?
I stopped, and I am the way, the truth, and the life.
What's your favorite verse?
My favorite verse. I asked him, sir, can you interpret for me for 2 minutes? And the apostle remembers he's watching. He said, yes. And when I began preaching, I said, the Bible says, and he said, Biblia inasema. That was the turning point of my life. I preached that word like I have never preached.
You didn't preach for 2 minutes.
I did not take 2 minutes. I don't know, it was 20 minutes or so.
Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content, of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live.
And we are back on Health Check on Hope TV, where you look and live. Thank you for choosing to watch Health Check. If you're watching us on Facebook, you could do everybody who follows you a solid by sharing this video, because I'm sure somebody needs to know just what it is, what it looks like, and how you could just be having a what seems regular headache, or whatever symptoms it could be, and you actually have a brain tumor, you could save them. My assumption, Tari, is that the sooner you realize, the easier to manage and the less effects you might have, when you have a brain tumor.
Yes. So the sooner we diagnose, the better, because that means also in terms of size, it's smaller. So generally, the smaller the tumor is, the easier it is. If it needs surgery, the easier it is to operate, the less side effects you'll have. Because with the bigger ones, it means by the time we're seeing the patient, it's affected so many parts of the brain. In terms of removing it, it involves going to so many other areas. And so the risk of injuring normal structures is higher.
Absolutely.
So early diagnosis way easier to manage.
And thank you for the questions that are coming in on 22232. I just want to introduce my guests one more time for you who has just joined us. Probably you are cooking. It's okay. You can continue to watch the episode. It's going to be on YouTube. It's going to be on Facebook. I have with me Dr. Susan Karanja, who is a neurosurgeon at the Kenyatta National Hospital. Thank you so much. Do you have another practice?
Yes, I'm also at Sage Surgical Clinic at KMA Center.
Okay, Sawa. I know these things. And also with us, our very own Rev.Judy Anabwani, who recovered from a brain tumor that was suspected, I'll say allegedly, could have been there for, considering the symptoms, a span of about 10 years. Wow. And that's what we're talking about. We started on this, and I could just start with a question that's here, because this is very, very important. One is saying, hi, health check, good show. Does frequent headache be a sign of brain tumor? I am worried for someone who takes painkillers on weekly basis due to headache, watching from Langata. And I think you had highlighted this, but you could just mention it one more time for someone who just joined us.
Okay. So for that person who is having the weekly headaches and is treating themselves, have them come to be checked by a doctor, because we never know if it's just a migraine until we've checked, examined, done a scan. And then once we see there's nothing on the scanner, we can say, okay, proceed with your painkillers. But any headache that is so bad that you're taking medication every day, you're safer coming for a scan at least. Make sure everything is okay. So please tell your friend to come see us.
Yes. And it's like also getting to be an addiction, because that's not a way to live, really.
Exactly.
Let's talk about the coffee takers. I'm not hitting anyone. I'm not hitting on anyone. Oh, I'll have a headache if I don't take my 4 cups.
Yes.
I need my 4 cups. Just talk to them. Just kidogo. I know it's kind of digressing, but talk to them.
No, coffee takers, that is an addiction. When you're getting to that point where if you don't take coffee, you're addicted to caffeine. And the advice is they start scaling back, because caffeine at the end of the day, it's good in everything in life is moderation. So in the small amounts, it's okay. But when it comes to a point where you're dependent on caffeine, that is an addiction. And caffeine, basically, all it does is amp you up. So your pulse rate is very high.
It has nothing to do with your brain. Your brain is perfectly normal.
Yes. So it's your coffee that's a problem. Scale back slowly. And those headaches will disappear.
Absolutely.
Yes.
Daktari amesema, it wasn't me. So I was like, Kerry, how don't you take coffee? Me, I will never be addicted to it. I take tea. Okay, let's talk about this. We were coming into treatment, but on diagnosis, Reverend, you've shared with us, you had the scan taken and they discovered what this was. And then the proposed treatment was one for you.
Yeah, there was no option.
Actually, is there other options?
So for brain tumors, generally the treatment is surgery. However, we have a unique class which we call the low-grade gliomas, which at diagnosis, if we find it's very small, we have a chance to do what we call the wait-and-see approach. So the very low-grade tumors, what you call, as calling grade 1 or benign, if we diagnose them early and they're very small and they're not causing any major symptoms, we do follow up for a while and see. If it's not growing, then we don't operate. But generally for most of the brain tumors, including like Reverend's, I believe the reason for operating was because it was so big, it was getting to a point where it's compressing on the brain stem and affecting now her breathing center. So in such a case, you have to operate, because that is a life-saving procedure. If we had left it, it should have continued to grow, and one day, unfortunately, she'd have maybe had difficulty breathing and ended up on a machine. So not all brain tumors have to be operated on, but the vast majority in our setup, because we diagnose them late, we do have to go to theatre.
Reverend, how do you prepare for a brain tumor surgery? Emotionally, physically, spiritually, please tell us.
It was so tough. The truth is, I'm Reverend, and I had preached a powerful sermon the Sunday before about the man that was at the pool of Bethesda for 18 years.
That was the sermon you
That was the
preached
sermon I preached the Sunday before. You can imagine. And that's the sermon God brought back to me when I was in the MRI machine. And he told me, this sermon was not for the congregation.
It was for you.
It was for you.
I assume the pool of Bethesda in your case was all the other doctors you were seeing, and nothing was happening anyway.
Yeah, the message was for me. And every time I was in the machine, the Lord will bring it back. Because the MRI machine itself is also very scary.
Yeah. Is it the one you enter your whole body?
Yes.
And then you can't move?
Yes. You can't
Whoa,
swallow.
that's the one.
And you are there like for 45 minutes.
You can't swallow?
Yes.
Okay.
I was told, don't swallow, don't move. And you are there still alone, no noise. It's like a fridge or a coffin. So it was a very scary experience. And that time, I think the MRIs in the country still did not have music. I think the last time I went, they asked me, which station do you like? I said, Hope.
You better have said Hope. I was just waiting.
So I could listen to Hope FM.
Inside the MRI?
The last time.
Wow.
But initial stages, it was just you alone, dark in that cold place. So the Lord just preached that message over and over again to me. But this night, after the neurosurgeon left, my husband left, I just broke down. And truth be told, I cried the whole night. But about 4 a.m., I sobered up. It's like, I need to make a decision. Am I going into surgery right away? Because I'd had a series of hospitalizations over like 6 weeks. And now I'm here. I was just discharged like a week ago, and I've been here again a week. I looked at the ceiling and I felt I was being suffocated.
Yeah.
And in the morning I prayed. I did my devotion, and God gave me a verse that really guided me on how to move forward. My devotion that day was on Romans 14, the entire verse. There's a place where Paul says, for me to live is Christ, and to die is gain. I stood there, I was like, God, is this what you are saying? Should I just prepare to come home? Should not bother to go into surgery? Then the Spirit said, no. I continued reading. Then the last verse helped me make a decision. He who does something without faith sins before the Lord. Oh. And I knew deep down within my heart, I didn't want this surgery. I didn't want to go to theater with this doctor. Actually, Dr. Beat was the scary part of it. So the surgery is already so scary. The language of the doctor scared me most. Oh. And I didn't want to see that doctor again. So that verse really put me at peace. And when the doctor who checked me in came, he came to check on me to just find out about my discussion with the neurosurgeon, and I explained to him. And it took a lot of time to just help me debrief, such a sweet doctor. And then I asked him, Doctor, if it were you, would you go into theater right away? He said, no, this is major. You need to digest it. You need to get used to it. You need to be ready. And so as a child of God, I knew I had been weary so much physically. I needed to regain. I needed to put my spiritual life in order, because it could be successful. It could not be. So if it failed and I ended up going to heaven, will I be in a good place with the Lord? And how is my house? Because my children were so young then. So I just decided to get a discharge, go back home, and continue the conversation with God. So I went home. I just told the doctor, okay, then discharge me. Are you sure? I said, yeah. So he discharged me. My husband came, are you sure? I said, yeah, I want a discharge. So I got discharged, and guess what? The following Sunday, I got discharged, I think on Saturday. Sunday I was in church and I was doing announcements. And
you don't take anything to the congregation.
Yes.
We tell you, pray for your pastors. Do you listen? Pray for your pastors.
And interestingly, I was asked to do announcements. Okay, I thank God for the senior pastor that I was working with then.
You can thank him.
Yeah, Rev.Judy Anabwani.
Yay!
He was awesome. He was just so awesome.
He's still awesome.
Yeah. He didn't allow me to wallow in self-pity. You are here, work. Yeah. And that was therapy for me. So he gave me an announcement, but we agreed he's the one who will do the bit of what has been happening, because I've been in and out of hospital. And of course, the congregation were worried, what's wrong with our pastor? There was speculation. People had different stories as to why Pastor Judy was sick.
As Kenyans.
Yeah, some were like, she's losing pregnancy. Look at the way she's skinny. There were all sorts of talks. Yeah, so sometimes even us women, let me talk to women a bit.
Please, look at the camera. I'm with you on that one.
when one of you is suffering, before you speculate and come to conclusions, get close and find out what really is happening. Don't be far, but you have things that you're talking about that do not add up.
I think we talked about it, whether she's getting thin or bigger. Could be she's on steroids, on a lot of medication that are making her get bigger, or could be, many things. Just mind your own body and mind your own business and ask questions. I mean, someone can't approach you to ask questions. I think. Sorry about that.
And I was skinny, by the way. I was 48 kg.
Wow.
I had 2 babies. I was on 48 kg for ages. I would never pass. I would conceive, add weight when I'm expecting. After delivery, I go back to 48 kg. So I was there for so long, and people could not just understand this mother that is skinny like a high school girl. And the talk was horrible.
I'm sorry. Sorry,
but I managed. When you're a leader, you thicken up.
You do.
Yeah, you thicken up. So that day, the senior pastor tried to make that announcement, but it was so heavy, he couldn't handle it. So I ended up being the one to break the news during the announcement. Thank you for praying for me. I truly appreciate, but I still need you to carry on because I was just diagnosed with brain tumor. I said it myself.
The church went quiet.
The church went quiet. You could hear a pin drop.
Yeah.
So I was the one to encourage the church and continued with the announcements and continued working as I am hearing what the Lord would have me do. Yeah. Should I prepare my heart to go to heaven, put my house in order, like Hezekiah was told, or should I pursue this?
Yes.
But to be honest, I was not going to check in for surgery. I was not going to make that decision to go in after what I'd been told. So there's also...
Dr. Your work is hard. Your work is difficult.
Yeah. So I thank God for friends. I'm privileged to have pastor colleagues who genuinely care about me. So one of them came. I will also mention his name.
Please mention.
Reverend Mugambi, the senior pastor of Sitamboli Road.
Pastor.
Yes. Your pastor was my lecturer and he's my good friend. So he came to see me after he got to know. And he told me, he speaks prophetically. Sometimes you think he's overdoing it, but that is how he speaks. So he just said, Judy, do not even dare do this surgery here in Kenya. Those were his words. Don't dare. And what he said seemed to confirm what I was sensing in my spirit. Then a friend of my husband also said the same thing. Okay, I was afraid of my head being opened up. So my husband's friend said, India, they have a technique that will not open up your brain. They call it laser. So I had hopes.
Is that a thing?
Well, I know radio surgery.
Okay, radio surgery.
Yeah, so they said there's this laser in India, they will not have to open your head. So I got kind of, there is hope for me because for real, I was not going in for surgery. That's when I said no. So when I heard there is laser in India, I said I could give it a try. And we started the process of India. And I thank God again for my organization.
Yeah.
I think they made history when they took me to India for treatment. Insurance could not deal. They waited for insurance for a long time. And so CITAM had no choice but just to wire money to India for my treatment, expecting insurance to reimburse. And I'm forever grateful to CITAM for just the leadership making that decision at that time. And so we go to India. But before we went to India, they tell you to send the MRI reports and the videos and all those things. And they evaluate it and they tell you, this requires surgery. So when it was sent to India, India said I must undergo surgery. The same thing that was said here. And they also specified the number of hours that it would take. And they gave a quotation and they sent us CVs of the doctors in their neurosurgeon department. They sent us 3 CVs. Some had worked 10 years, 15 years, 20 years. So we chose the most qualified.
The middle one?
No, the one who had so many years of experience.
Okay, sorry. I thought when you get 3 quotes, you pick the one in the middle.
No, we did want to,
Yeah, I get it.
So we took the highest.
Yes. Most experienced.
Most experienced. And so we were in touch with the doctor before we went there, and they told us everything that they were going to do from A to Z before we went there. And the church flew us there, my husband and I, and the hospital received us at the airport. And I went in, and the doctor was in surgery, and I saw him in between surgery at the corridor. He looked at my papers, he said, "Go and sleep in my office." Imagine those were his words. "Go and sleep in my office, I'm coming." I was like, wow, this is unique. Yani, the doctor is telling you to go and sleep. So his PA took us to his office, and I just slept there, and he came and he looked at my papers again, and he said, "This is admission right away. We need to deal with it right away." So test began. They do all tests. They don't rely on what we did here, so they do all tests. So from 6 p.m. to midnight was just one test after another, then needle by mouth. Then surgery was performed the following day.
We're going to get into your experience for surgery, but Daktari, you are here treating Kenyans. We thank God for our organization. Even me, I thank God for your organization so much.
Yeah. We are blessed.
Yeah, but as we think about that, we've realized that, okay, so you've explained clearly that depending on the size, you can watch it, but also there's now what it's doing to the rest of the functions of the brain, and this is now in treatment.
Yes.
How do you prepare somebody, regular Kenyan, because clearly this one is in heavy, mwananchi amekuja Kenyatta National Hospital, they have a tumor. What happens?
So the first thing we'll do is, one, take them through the scan. They have to understand what it is,
Yes.
where it is.
Yes.
And so we explain the area where it is and what that part of the brain does. Because now when we're telling you about surgery, we try to go through the steps, but we also, the process where someone gets to sign the consent, we have to take through the possible complications. And the complications, other than the general ones of most surgeries, with the brain, we have to tell you the unique complications that could come from that particular area. So that when you're signing the consent, you can be aware things can go 100% excellent, or this can go wrong, and this is what we might see. So after we've taken them through the diagnosis, through the consent, then now we start our tests also. So we go through the blood test. In some instances, depending on age, you might say now we need to do a chest x-ray, we need to check on the heart before they can go to anesthesia because of the risks of anesthesia. Then once we're happy with that, all the results are in order. And of course, nowadays, because of COVID, everyone has to have the COVID test done.
How long does this take?
Well, with Kenyatta, it takes quite a while because, of course, we have a waiting list. But at the point of being admitted, normally we admit and we let the patient know. So we're admitting you today, and we anticipate you'll be in theatre. For example, today is Monday. I'm admitting you today with the hope of getting you to theatre on Wednesday. So that Tuesday is spent just trying to get all the tests in order. We also give the family time to get donors, because for neurosurgery, we must always have blood available for transfusion. So we normally give 24 to 48 hours for them to organize themselves and have all those things in order. And then now in the ward, we allow the patient time. If you want to ask questions, with medicine, ask questions. Even when you're being put on the theatre table and you have a question, ask. Yes, because there's nothing bad like going into surgery, something happens, and you're like, and I thought this would happen and I didn't ask. So we always say ask. So we work with about 24 to 48 hours timeline to get you into surgery. Yes.
That's reasonable.
Yeah, simply because also, as Pastor Judy has shown, it's a very, anything to do with the nervous system, whether it's a brain or spinal cord, it's very anxiety-inducing, and it's very difficult for someone to sit in the ward and just keep replaying in their heads, I'm going to surgery on my brain. So the sooner we get it done, the better.
Wow, how do you prepare as a doctor to someone's brain?
Praying. So the first thing we do is we pray over every patient, because there's no such thing as I've done 60 or 1,000 of these. Every case is unique. And simply because as a human being, you yourself are very unique. So one of the things is to pray.
Yeah.
And then in reality, for most neurosurgeons, if I know I'm operating on someone tomorrow, from the minute the decision is made to operate tomorrow, the whole day and night, we just keep replaying that surgery in our heads.
How you're going to do it.
How you'll do the cut on the skin, what you'll do with the bone. And then you keep replaying scenarios. If I find this, this is what, if I find this is. So with neurosurgery, it's a very mental thing.
It is.
And you do the three-dimensional, when you see the scans, you immediately reconstruct the brain into 3 dimensions and you position where that thing is. And so the whole night and day, you're just operating until you finally get to theater. And now start the operation.
Yeah.
And again, pray before you start.
That's quite interesting. Someone is asking, ask Dr. Susan, how can we prevent brain tumors? And are there types of brain tumors? And are all types of brain tumors curable? You can respond to that as we continue to see Reverend in surgery.
Okay. So prevention of brain tumors, that one is difficult because, as I've said, most of them are sporadic.
Yes.
So it's only in those who we know that there's a familial genetic line where we can say we screen them. But for most people, what we recommend is early diagnosis. So those small things you're feeling and like, they'll go. Those are the things we're saying, come early, because coming early really affects the outcome of brain tumors. And for example, in terms of recurrence, it gives you a much longer time before recurrence if you come early and it's small. So early diagnosis is what we push for brain tumors. Then,
Sorry, before you go on, just hold the thought. Are there times that there are no symptoms?
Yes.
Okay.
Yeah, you can have no symptoms, and especially that tends to happen with tumors that are, especially on the right side of the brain for left side dominant people. And it's in a part of the brain that we say is non-eloquent. It doesn't control anything major. So as long as it's small, someone might never know.
Okay.
And then when we go scan, maybe accident or fell in the house, you do a scan and find, oh, there's actually a tumor.
Wow.
The other ones which are notorious for being very quiet are tumors of the pituitary gland, because unless it's very big and starts pressing on the eyes that apply the nerves, or unless it's one of the ones that produce hormones, we'd never know.
Okay.
Yeah.
Okay, you can proceed with what you're saying.
Yes, so I think the other part of the question was, are all...
Are all brain tumors curable?
Curable, yes. So unfortunately, no. So we have what we call the high-grade tumors, which now are the malignant ones and the class grade, what we call grade 3.
Which are the bigger benign ones?
They're still malignant.
Okay.
So we call them high grade because of that malignancy.
Okay.
Those ones we don't cure. So what happens is we'll operate, try to remove as much as possible. But in reality, because of how it grows, there's always a bit left. So it won't be a complete cure, and there's a chance of it recurring, or it even just progresses. We operate and then we do a scan a few months later and the thing is back. So not all of them are curable.
How many surgeries can you do?
I think in the West, in the US, is where they have done many, because I think they've done up to 10 in one person.
Wow.
Yeah.
Over a span of how long in the research?
You see, if, for example, a low-grade tumor, even if you have to do every 5 years, it can be done. Yes.
Okay.
Yeah.
Wow. Daktari, Reverend Judy, you have slept and you've met the doctor.
Yes, the doctor came, woke me up, did his other checks on me, checking things to do. I think he wanted to see at what level I am in the process of, how much the tumor has affected my life. Yeah, then I got admitted right away. He said, we need to operate tomorrow. And they did all those tests that were needed before I could go into theater. Then I was taken to theater. But it was a team of so many doctors that were attending to me. The anesthetist was there. Then my surgeon, his assistant, dietitian, all that team, about 8 to 10 people to one person. They don't leave anything to chance. And all of them come introducing themselves to you before you eventually go in. But by the time I was going in, I think I was very weak. I had deteriorated, even mentally. I think I was becoming psycho or something.
Oh, no.
Yeah, the pain had really wasted me. So even when I was going, it's like I was in another state. I was neither here or there. Whatever happens, let it happen. But I'm just following this route because I can't just sit. So they also said it would take 6 hours. So I went in, but what shocked me, those guys, as Doc was saying, you pray. They pray.
Wow.
Yeah, all those guys were praying. I couldn't hear what they were saying, but they were praying.
Yeah.
You know, some of them are Muslims, and that's like, I think that each and every person was invoking,
to their God.
was praying to their God. Yeah, so I found that so interesting. But of course, I didn't know how long they prayed because within a short time they had given me the anesthesia and I was out. And they did the surgery. They had anticipated that I would be in ICU for 2 days, but I ended up being there for 5 days.
Why?
The surgery was complicated.
Yeah.
It was complicated, and then I didn't wake up when they had expected I would wake up, and they were worried.
Did you see heaven?
Kinda.
That you'll tell me on the side.
Kinda.
Yeah.
There were things I saw that I think would be very hard for a person to.
Please write a book.
Yeah, one day.
One day.
Yeah, so waking up was a problem. I didn't wake up when I was supposed to wake up, so I don't know the details, but I didn't wake up. I think an hour later or maybe after the expected, yeah. Then I woke up. Then I was taken to ICU, but the ICUs were very different. Everyone in their own cubicle with a nurse. Okay, my husband is the one who knows the story because me, I didn't know how they, I didn't see anything. Yeah, so, and life in ICU was very tough. It was a matter of life and death in ICU.
Yeah.
And it's not for the faint-hearted.
No, it's not.
Yeah, you must be really determined.
Yes.
And you really must have a power behind you. And me, I know God was there.
Absolutely. You had to be here to encourage people because I'm sure the people who are watching and probably they can't even speak because of the pain and the trauma. I can see time is like telling me to wrap this up, and I can't wrap it up without just asking you, what are some of the things you've done so far, like up to this point, to just get back into life? Because you said you used to feel so cold. Right now, I'm freezing. You are, you know.
My life changed. I can take black tea, which I could never take.
Oh, because of the burning.
Yeah, I can take sweet potatoes.
Yummy.
All those things that I could never eat, I found myself eating. You know, in India, they don't do milk. So basically, after surgery, they were giving me black tea and so many drinks. So my system actually got used to drinking black tea. I hear the brain develops a certain habit, and once it's like I had to create a new habit.
Yeah.
After surgery.
Did you have to learn anything new, or
speech was gone, movement was gone, because it was at my cerebellum. I think Dr. would know. It's also the area of balance, so I couldn't walk. I couldn't walk on my own. Speech was dragging. Yeah, but they worked on me also. I was with a speech therapist. They really work on you. Physiotherapy, they were working on me.
And all this is post-op care.
Yeah, post-op care. And it is a long time. It's not a day, it's not a month. It's taken me years to be where I am today, even to be able to walk in heels.
Wow.
This just started last year.
Wow. But you're here.
Yeah, I'm here. It's a long journey that requires a lot of patience in the patient and the people around the patient.
Absolutely. And that support you had at least. Absolutely.
I had support at home and I had support at work. The other thing that I was told is that I must continue doing the things I used to do, otherwise I'll forget. So I had to carry on. I'm in pain. I am my hand is being held, but I'm preaching. That's why I thank Reverend Jesse again.
Yeah.
Because he allowed me to preach when I couldn't walk. Otherwise, I would never have preached again. So I continued struggling like that in pain, but going back to normal life, because if I don't go, I will lose it.
Yeah, absolutely.
Yeah. So I'm here because of God.
We need this story on radio. We'll talk. We'll talk. Hi, my husband got a tumor in 2018, and again this year in June. We are advised to go to radiotherapy, and they're still struggling to get treatment. I think this one probably we can call them after, because they haven't started and it's been a month, so they're a bit sad about that. What is saying? What's the difference between a neurosurgeon and a neuroradiologist? Someone just asked that. Do you want to reply?
Okay, so a neurosurgeon is the person who operates on diseases in the spine and brain. A neuroradiologist is now the one we work with. So it's a person who does the diagnosis. So a radiologist, the one who does the CT scan and MRI, who is specifically trained to just look at conditions that affect the brain, the nerves, and the spinal cord.
Wow. Do you have many of those in Kenya?
No, we don't, yes.
So that's a field that we need to look at.
Yes.
Doctor, I just want you to encourage someone just as we continue, because I have like 2 more questions to go for you. But encourage people to come up and see the doctor.
Yes.
What can we do about that?
I think for my advice would be, you as a person need to be your own advocate where health is concerned, because at the end of the day, you're the one who knows how it's affecting your life, how you're feeling. So it's just to be conscious enough, love yourself so much that you decide, you know what, I'm not going to suffer anymore. Let me go see someone.
Yeah.
And at the point of seeing someone, if you feel your headache has been so bad and all people are doing is prescribing painkillers, as a patient, you have a right to say, you know what, I'd like to have a scan.
I need a second opinion also. Like
second opinion, scan,
scan.
those are all within your right as a patient to ask
say,
for.
okay.
Because also that peace of mind is important.
Yeah. Okay. Let me ask for care over, post-op care for a patient. What are some of the things you really needed and desired and got?
I needed people around me to be patient and just to accept me back, but it wasn't easy. But God stationed people on my way that accepted me. I was told I cannot be given a crutch, otherwise my system will read the crutch and I will never get back to normal. So I had to hold people's hands. And that is the time I didn't care whether you are male or female. I would just grab your hand. Yeah, and I hope people around me understood that I needed that to survive. But there are people who did not understand why this pastor is walking like this instead of just sitting at home. And so people really need to understand and appreciate where this person is coming from and where they are going. Because I needed to do those to be able to get back to life. Otherwise, I would have remained in that state. And I think it's also good to create awareness around you. Like before I went, I told my children, even though they were young, 4 years and 5.5, but I had to look for a language to just explain to them what was going to happen to me. And when I came back, they were shocked to see that mommy came back in a wheelchair. Yeah. The last day I was going, I actually drove them to school and brought them back home. But now I'm coming back a month later in a wheelchair. That was very shocking for them. And I couldn't move around. I couldn't talk properly. I couldn't do the things that I used to do. But gradually, I picked slowly by slowly, could preach a sermon in 15 minutes or 20 minutes, slowly by slowly, clinging to my dear life on the pulpit. Yet less I speed, because that was the consequence. I would lose my balance and just pain. Lose my balance and just pain. But also care, medical care after is still also very expensive. And very few neurosurgeons have the patience to work with someone after surgery, because I think they're handling huge cases, trying to save lives.
Sister, move on.
You've recovered. There's no that patience, yet you still need it. Actually, I almost died back home because of lack of care. I was given wrong medication. which affected me, and I was literally dying. And then that day, I was ready to go to heaven, but God was not ready to.
No.
Yeah, our bishop just showed up in our house at night, which is not
Yeah.
conventional.
Yeah.
And he found me ready to go to heaven.
Oh, wow.
And he prayed that night. And then we got the insight to just ask the doctor in India, what can we do? And India, they respond very fast.
Yeah.
My husband wrote in the night. When we woke up in the morning, there was a response from India, writing a drug that was going to suppress the other drug that I was given.
Yeah.
So I almost died back home because of lack of medical care. Not that we didn't have the money, but someone to just attend to me medically.
Yeah.
It is the doctor in India that got me a doctor in Kenya that he knew was reliable, who worked with me for like a whole year.
Wow.
So that now, that time, yeah.
It's
Managing.
good to ask questions. I think, Doctor, you made it so clear. If something is not working, or, also we have that sixth sense. You know there's something wrong.
Yeah.
This is not working for me. I think we should be bold enough because I think, Doctor, you're here to serve. And, it shouldn't be a big deal for me to ask you a question and probably, if you're feeling a certain way, get a second opinion. So let's be bold enough. Unaonanga daktari unaogopa. Nasema, mimi sijui yeye ndo anajua. So it's good to ask those questions. Daktari, what would you encourage families to do post-op care? What would you advise?
For brain tumor patients, family support is very, very important, which is why even before we go into surgery, we'll rarely let the patient make the decision alone. So a lot of times we'll ask, who are you with?
Yes.
Because we know and understand. Sometimes, as Reverend has said, it's years of working with someone. Some people are not lucky to come out of surgery like she did and recover. Some that inability to work, that disability is a lifelong thing.
Oh, no.
So if as a family you're not committed to work with someone that journey, you see, it will get to a point you fatigue and leave them. And then what happens? They get depression, and generally the body and the mind are so closely linked.
Yes.
So if your mind gives up, then the rest of you gives up.
Yeah.
So it's very important to have the support, whether it's a family or friends, whether it's a church, always have someone who can support them through the brain tumor diagnosis. And the other thing, for us, surgery is just the beginning of the treatment. There's so many other services we work with. So we will always insist, go see a physiotherapist. And Kenyans have this habit of, we'll write physiotherapy, then you see them and ask, and they're like, pana, nimekuwa niki-exercise nyumbani.
You're like, that's
And
not
it's
the point of
different.
physiotherapy.
Yes, it's different. A physiotherapist is there to make sure you don't lose something.
Yes.
And we're trying to teach your brain to bring it back. So physiotherapists are very important to us. Nutritionists are also part of our team. And in the case of malignant tumors, we bring in our oncologists, the radiologists. So each member of that team has something they tell you, and that is important. So the same way the medical fraternity are handling you as a team, at home, you need to be handled the same way by a team.
Absolutely.
Yes.
The conversation going on, and if you've missed it, you can catch up on Facebook and YouTube right here on Hope TV, where you look and live, is on brain tumors. And it's very interesting that we can have this conversation. See Rev.Judy, who recovered completely. I think I would say completely, because honestly, you are doing much better. I think at how many kgs, right?
I've added like 10 kilos in a very short.
These are confident women who can talk about their weight.
Yeah.
She's like, and Dr. Recurrence. Let's talk about that, and how can one be prepared for recurrence and.
Okay, so recurrence, again, goes back to what I had said. The earlier the diagnosis, the more we're able to push the recurrence. But in some instances, after surgery, we'll be able to tell you, for example, in a tumor that is involving the nerves and vessels, we won't be able to remove everything.
Yeah, so you have to make a decision, because
so in theater, we make a decision and say, you know what, let's remove what is safe and leave that part, because if we touch it, it will kill the person. And so we'll tell you even from that point that we couldn't take out all the tumor, we've left this amount, and so we expect recurrence to come a lot earlier. So one of the things is, unfortunately, most brain tumors will recur. It just varies on how long a time frame it is between the surgery. So how much we're able to take out affects recurrence. And then also in some instances, when we can't remove all of it, we opt to bring in now our oncologists so they can do radiotherapy or chemotherapy, and so push the time to reoccurrence for us. The very low-grade tumors, when we're able to remove everything, that one is as good as a cure. Yeah. So we do try to prepare our patients after surgery, depending on what we find, and let them know yours, the chances of it coming back sooner are higher. The ones with now those familial conditions I spoke about, of course, those recurrences are a lot more common, and that's part of the talk when you're even planning surgery for them. Yes.
Reverend, what's your message to our viewers? Because I know you're not here. You're here on assignment for sure from God, that you had to be here at this moment. What would be your message to anyone who's watching?
Anyone who is watching and they've noticed their system is not the same, there's something they're struggling with, just the same way doctor has said, seek medical attention and do not settle until you know exactly what is going on in your system. And then whatever the diagnosis you get, take another step and just deal with it, because there's no other way. Trust your God, talk to him, and find a way forward. And just deal with him, trusting that God is able to bring wholeness back to you. Like for me, people really prayed for me. People who know me, and even the ones who don't know me, I must say, I was blessed to be a pastor. So the entire CITAM fraternity were praying for this Judy Anabwani. They don't know her. Those days, Facebook was not really working like now. Okay, I was already on Facebook, but not many people were on Facebook. So they really didn't know who Judy. So I would go around preaching in different cities. And I said, you are the Judy Anabwani that you are praying. You are the Judy. So the church really prayed for me. And for me, I think my recovery, even from waking up from theater, overcoming in ICU, where I had to demand for a cross, because I realized here I have to declare my stand.
Kabisa.
Yeah, and I had to cling my cross made with 2 pens and a rubber band, and I wasn't letting go. The enemy needed to know that I belonged to God.
Kabisa.
And faith played a very big role in my recovery and who I am today, and colleagues who just understood and allowed me space to get back to work. It's all God and understanding. So the people you think will be there for you will not be there for you, because even in my case, there are people I thought would be there who took a flight. But God raised others who decided to be there for me. People that had never been acquainted with just decided to be there for me. So if people disappear from your life, don't feel bitter, don't curse in your heart. Know that you are on assignment, but God will take you where he wants to take you. Yeah, just dedicate your life to God.
Yeah.
You see, when my going to India, it was miraculous.
Yes.
Yeah.
Absolutely.
Yeah,
Wow.
and just using, I think here I would have used probably 5 million or 10 million. There I used under 1 million. You see.
Wow. Okay.
So God just orchestrated every agenda concerning me, because I think there's something he still wants me to accomplish that is not yet done.
I love it.
I believe that. That's why I'm here. And the joy to see my children grow up, that I can't trade for anything.
I know.
Yeah, that.
I love it. I love it.
And to be able to preach the word of God and just tell people it is possible to trust the Lord to be healed and to get whole. He uses many ways to heal us.
Even the pain and the turmoil you went through for years and years and years is for a reason.
A reason. By the way, I still go through pain.
Yes.
Because the spine, I think, is healing very slowly.
Yes.
So my neck is constantly in pain,
Yeah.
going down to my spine.
Yeah.
But it's not compared to what I went through before surgery. It cannot, because I can drive myself, I can move around. Although I know sometimes when something comes in my system, maybe I'm not feeling well for a different reason, it will trigger the brain.
Yeah.
And so I have to slow down. There are times I can't drive myself, but I know when those instances are coming.
I think muhimu tu ni maisha. You are alive, you are breathing, you are here, lady in red. That's a lovely, lovely testimony. I think we have to wrap it there, but Daktari, one word for our audience. And there's something you mentioned on mental health and wellness and actually getting your brain scanned if you're seeing someone struggling with some things, because it could be a part of that. Could you talk about that just as you give your closing remark?
Okay. So that was to do with psychiatric illness, where one of the manifestations of a brain tumor of what we call the frontal lobe is actually that. So personality change. So you notice maybe Kerry has always been shy, quiet, and suddenly now she's loud or she's all over the place screaming. And then, there are people who would never give testimony, suddenly now every Sunday and it's any church. So that sort of behavior where to you it looks bizarre.
Yes.
We this is why God did not make us to live in isolation. So if it's your husband and you're like, this guy has changed, it could be there's a brain tumor affecting him, and that's why this personality has changed. So take them to see someone, a psychologist, a psychiatrist, and most of the time before they start treatment, the psychiatrist will insist on a scan just to make sure there's nothing, and that's how some people have been diagnosed.
Wow. And they've gotten better.
Yes.
What would be your closing word as we wrap up this episode?
My closing word would be brain tumors are a treatable condition, and we are treating them here in Kenya. And I just urge our viewers, if you or someone is displaying any of these symptoms, just come and be checked.
Absolutely.
Yes, it's nothing worse than missing the diagnosis or coming when it's too late.
Yeah. We have great programming lined up for you right here on Hope TV, where you look and live. My name is Kerry Kagiri. I didn't know how to go through this conversation, but these two beautiful women, we've managed to actually dissect and not even go through everything, but just what we could. Thank you so much, Dr. Susan Karanja. Thank you so much for coming through. Neurosurgeon at Kenyatta National Hospital, and Rev.Judy Anabwani, who recovered from a brain tumor, and she's continued to heal. And just thank you for coming to share your story. It's not easy, I'm sure, taking you back to those memories. So keep it right here on Hope TV, where you look and live. I'll see you tomorrow morning on Hope FM for Activate. It's Team Worship Wednesday. You know what we do. Bye. Thanks.